About every industry in the U.S. has struggled to attract and retain enough workers, and the unemployed aren't home strictly because of childcare issues or unemployment checks. There's actually a big X factor totally missed. McKinsey surveyed 5,000 Americans, and among those unemployed and not looking, 20% said it's because of their mental health. 45% said it's because of their physical health. Dr. Jessi Gold joins me tonight to go more in depth on this. She's an assistant professor of psychiatry at Washington University in St. Louis. Dr. Gold, 45% of the unemployed out of work right now, self-reporting it's because of mental or physical health problems. Does that track with what you're hearing from patients?
It's a big number, and I'm sure that number surprises a lot of people. But, over time, we've just been seeing a lot of mental health problems, and the mental health problems are due to so many things in our culture. We have so much grief, so much loss, so much illness, and just pre-existing mental health conditions. I think I've filled out more disability paperwork over COVID than I've ever done in my life in my job. I guess I'm not that old, but it still feels like a long amount of time. Plus, if you think about long COVID as an entire entity, there are a lot more people that have that than we talk about, and they have mental health problems. They have really challenging to work with physical health problems like not being able to taste or stand because they're dizzy. So there's a lot going on there.
You talk about some of the, I think it's called comorbidities, right, of having a mental health issue, and then you also have this physical issue. And physical health seems to be the driving factor here, but long COVID is completely intertwined in there. It kind of resembles other conditions, at least on the surface to me, of people asking, is this real? Like, what is the true origin? You have chronic Lyme disease, which some people say don't exist, chronic pain, chronic fatigue, fibromyalgia, all this. Is this going to be another one of those conditions that people look at it with a little bit of skepticism?
Everybody in medicine is skeptical when they don't have the answers. We don't like to not know things, so when something comes and the symptoms are confusing and they seem all over the place and we don't have a way to say this is what's going on with you, people don't like
invisible.
that. And so, yeah, they're invisible. Mental health problems especially, but even just some of their taste, smell, all those things are really all over the place for people. So I think, nobody likes to say, I don't know, or I'm working on it, or I think this makes sense based on what everybody else is seeing. But I think we need to get better at that in medicine. I think patients like it more. I think people feel connected to you more, trust you more if you're honest.
Mental and physical health are so interconnected, inextricably so in so many cases. Like, you don't know which came first. Does it matter which came first? I'm sure you're always trying to untangle that in your practice. Is that the same case here when we look at people not seeming to be able to launch back into work?
Yeah, I mean, in my practice is part why I go to medical school instead of just learning therapy is I learn all about the body at the same time as the mind. And so I'm able to understand all of that. And that's a lot of what psychiatrists do. But yeah, I mean, if you're struggling physically and then you go to get back to work and you feel like you can't because of a symptom, or you're worried what someone might think of because of the symptom, then that can make you sad. And then you might isolate, and then that makes you more sad. And so it kind of is just this vicious feedback loop where it's really hard to know. And then if you get more physically ill, you withdraw more, so you feel more sad, kind of back and forth, and which one's worse and which one's causing the problem. But for sure, it makes it harder. And if you've really been struggling, going back to a quote unquote normal work environment is going to be challenging, because it's been challenging for people who aren't struggling.
Dr. Jessi Gold, we sure appreciate your time, your expertise, and how much thought and care you've put into this. Thank you.
Thanks for having me.